Seeing hair, um, lint particles left on the mop after it's been gone through laundry and then being brought up into the patient care area for care is kind of gross. It can have an impact on their happiness with their stay. They're not happy when we come in or somebody comes in to clean their area and there are pieces of hair and lint on the rag that's there. It can be a risk for transmission if there's something left on that rag or the mop. Not proud. Not proud. I would hope that we could make a change so that we can appear more professional. We can make sure that we're providing our patients a better environment and decreasing that risk of transmission of microorganisms.